In this video, we will discuss about malignant eyelid tumors. Malignant eyelid tumors are the most common malignancies involving the periocular region. Among these, basal cell carcinoma accounts for nearly 90% of cases. Early diagnosis is essential to prevent local invasion and morbidity. Malignant eyelid tumors include epithelial tumors such as basal cell carcinoma, squamous cell carcinoma, and sebaceous gland carcinoma, melanocytic tumors like malignant melanoma, and rare tumors including Merkel cell carcinoma and Kaposi sarcoma. Certain inherited and systemic conditions predispose patients to eyelid malignancies. Xeroderma pigmentosum causes early onset multiple skin cancers due to defective DNA repair. Gorlin-Gold syndrome predisposes to multiple basal cell carcinoma. Muir-Torre syndrome is associated with sebaceous tumors and internal malignancies. Behçet syndrome and immunosuppression are other predisposing conditions. Basal cell carcinoma is the most common eyelid malignancy, usually affecting elderly patients with chronic sun exposure. The lower eyelid is most frequently involved, followed by the medial canthus, which has a higher risk of orbital invasion. Basal cell carcinoma may present as a nodular pearly lesion, a nodulo-ulcerative rodent ulcer with rolled edges, or as a sclerosing morphiform type that infiltrates deeply and is difficult to delineate clinically. Pigmented or superficial type is rare on eyelid. Histopathology of basal cell carcinoma shows nests of basaloid cells proliferating downward from the epidermis with characteristic peripheral palisading, surrounded by fibrous stroma. Squamous cell carcinoma is less common but more aggressive than basal cell carcinoma. It may arise de novo or from pre-existing actinic keratosis and has a significant risk of lymph node metastasis. Histopathology of squamous cell carcinoma shows dysplastic squamous epithelium with keratin pearls and intercellular bridges. In invasive lesions, tumor cells breach the basement membrane and infiltrate the dermis. Sebaceous gland carcinoma is a highly aggressive malignancy commonly affecting elderly females. It most often arises from the meibomian glands of the upper eyelid. Sebaceous gland carcinoma often masquerades as benign conditions such as recurrent chalazion or chronic blepharitis. Diffuse lid thickening, yellow nodules, and madarosis are important warning signs. Histologically, sebaceous gland carcinoma shows lobules of tumor cells with foamy, lipid-containing cytoplasm and hyperchromic nuclei. Pagetoid spread within the epithelium is a characteristic feature. Melanoma of the eyelid is rare but potentially fatal. Lentiga maligna melanoma is the most common subtype, and early detection with wide excision is critical for prognosis. Merkel cell carcinoma is a rapidly growing highly malignant tumor seen in elderly patients. Kaposi sarcoma is a vascular tumor associated with immunosuppression and HIV infection. These are rare malignant tumors. Management of malignant eyelid tumors requires biopsy for diagnosis, followed by complete surgical excision. Mohs surgery offers excellent margin control and tissue preservation. Reconstruction is planned only after confirmed clearance. For examinations, remember that basal cell carcinoma is the most common and rarely metastasizes. Squamous cell carcinoma is aggressive with nodal spread. Sebaceous gland carcinoma is a classic masquerader, and recurrent chalazion in the elderly must always be biopsied.